Welcome all to one of our first sessions for Equitable Growth 2022, People and Research Advancing Economic Evidence. My name is Maryam Janani-Flores, and I'm the Policy Director here at the Washington Center for Equitable Growth. As you know, this four-day conference brings together Equitable Growth grantees and other stakeholders to showcase cutting-edge research on how economic inequality affects economic growth and stability. Our interdisciplinary session today is entitled Importance of Gender Equality for Strong Economic Growth, and it features papers that look at different potential structural barriers to gender equality, including employment and workplace discrimination, access to reproductive health care, and corporate culture. The first paper presentation will be by Ingrid Haegele, who is an assistant professor of economics at Ludwig Maximilian University of Munich, presenting her paper, The Broken Rung, Gender and the Leadership Gap, which investigates when and why gender gaps in the leadership hierarchy start appearing. We will next have Naomi Cahn, the Justice Anthony M. Kennedy's Distinguished Professor of Law at the University of Virginia School of Law, and June Carbone, the Robina Chair in Law, Science and Technology at the University of Minnesota at Twin Cities, present their paper, Women versus the Winner-Take-All Economy. This paper theorizes that a winner-take-all economy is leading to persistent gender inequality in wages and roles. Our discussant was to be Nancy Fulbright of University of Massachusetts Amherst, but she is unfortunately unable to join us and sends her deepest regrets. We'll make sure that we have a robust Q&A to provide feedback to these very interesting papers, so please keep your questions in mind. Next up, we'll have Martha Bailey, Professor of Economics from UCLA, present on her paper, MCARES, the Michigan Contraceptive Access Research and Evaluation Study. This paper looks at how subsidies for contraception affect access by low-income women, and it's a very timely study for us to discuss today, given the moment we are in when it comes to reproductive health care access. Christine Durrance of the University of Wisconsin-Madison will provide discussant remarks. I should say for any of the presenters and discussants, I apologize retrospectively for any of my mispronunciations of your names. We'll have about 10 minutes or so for each presentation and each discussant, and you may hear me interrupting remarks to keep time, only because it's hard to see chat reminders when you're in the middle of giving a great presentation. After all of our speakers, we will open to audience questions and discussions, which I'll be moderating. One of the things that I enjoy most about our grantee conference is the amount of participation that often happens during the Q&A session. So I encourage you to submit questions into the Q&A box that you'll see on your screen on a rolling basis as they pop into your heads. And then I'll try to get to as many of them as possible during the Q&A at the end of our presentations. Please include your name and affiliation so that you get the proper credit for your questions. And you can also feel free to use the chat function if there are resources or thoughts you'd like to share with the full audience in real time. But again, please use the Q&A box. That helps with organizing all your great questions. Lastly, I, like many of you, are very excited for each presentation we have here today. As such, I'm going to drop a quick note in the chat about the tenor of participation we hope to see throughout the grantee conference. And with that, I'd love to pass it over to Ingrid for our first presentation.
Oh, great. Thank you so much for having me. I'm excited to kick off this session that is very dear to my heart and to present The Broken Rung, Gender and the Leadership Gap. So in 1986, this Wall Street Journal article coined the metaphor of a glass ceiling that deters women from rising to the top. This metaphor was immensely influential, inspiring policymakers, organizations, and researchers to try to increase female representation in top management positions. But not only is there limited evidence on trickle-down effects, suggesting that targeting the top alone may not be sufficient to improve overall representation, but increasingly practitioners hypothesize that critical gender gaps occur earlier on in the job ladder. So for instance, in 2020, there was a McKinsey report that wrote, "We often talk about the glass ceiling. In reality, the biggest obstacle that women face is much earlier in the pipeline, at the first step up to manager." The contrast between these two perspectives raises an important research question. When and why do gender differences in female representation occur? And is there something specific about the first step up to manager that matters for female underrepresentation? Much attention has been devoted to studying the top of the job ladder, but it's really difficult to find a lot of findings on lower levels. Few papers managed to measure hierarchy granular enough to be able to trace out representation along the job ladder and focus on women's careers within firms as they ascend the job ladder. Studying equilibrium outcomes makes it also difficult to pinpoint key determinants. We know from previous research that many potential drivers may be at play, for example, differential treatment of men and women, labor supply factors, for example, gender differences in risk preferences and confidence. We also know that job characteristics such as flexibility and pay are important for how men and women sort into different jobs. But when employees ascend the job ladder, when they get promoted, many things may change. It may be flexibility in pay, but it also may be having to take on responsibility over business decisions or over teams. And we know very little about how these changes affect female representation. So in this paper, I study a very large multinational firm and collect new data that combines a universe of application and job vacancy data within this large multinational firm with 2 large-scale surveys I run with these employees. And this allows me to study gender differences in preferences, in perceptions, and in realized outcomes in the high-stakes real-world setting of a large multinational firm. And by constructing a granular measure of job hierarchy, I'm actually able to look at differences in applications along the job ladder, not just at the top. So what I do at the beginning of the paper is I want to test the hypothesis that women are less likely to apply for promotions. So I'm going to use my hierarchy measure to look at different parts of the job hierarchy. I'm going to use my meta-analysis sample that contains over 400,000 employee by quarter observations from 2015 to 2019. These are mostly white-collar and management employees in Germany, which is the biggest internal labor market at the firm. I'm going to run a logit regression to estimate the probability that employee I applies for promotion in quarter T. And I'm going to control for a very large set of employee characteristics, so including marital status, tenure, family status, parental leave history, position titles, function. I'm also looking at things like performance, potential ratings, hours, trying to make sure I compare men and women in similar positions with similar qualifications, who could have similar career progressions, who could make similar application decisions, and trying to understand whether women are less likely to apply than men. So column 1 here shows you the results for employees in lower level positions. This is the bottom of the job hierarchy. So this is an entry-level engineer, for example. The first row is the logit coefficient. At the bottom, you see the gender gap in percent based on the average marginal effect for women. So you can see that even conditioning for like a really large set of employee demographics and position characteristics, women are 28.6% less likely to apply for a promotion in a given quarter than similar men. So this is a really big gender gap. In column 2, I show you results for the middle part of the hierarchy. So these are team leaders, project heads, experts. You can see here, I don't find any gender differences in applications. Similarly, in column 3, if I look at any type of leadership, I don't find any differences. So this goes from a team leader up to the level below the CEO. And while I'm showing you 3 different selected samples here, one key takeaway from this table is that while we've focused a lot in the past at looking at gender differences at higher levels, I find a really critical gender gap emerging early on as employees sort into leadership positions. So for the rest of the paper, I'm going to focus at these employees in lower level positions, trying to understand why promotions are less appealing for women than for men. Just one disclaimer, this is not just driven by the standard demographics. I still find really large gender gaps for employees who work full time, this is column 1, who don't have children, this is column 2, and who are not married, this is column 3. And in the paper, I showed that these gender gaps in applications are limited to promotions only. I find no differences in applications for lateral transitions, even if they require you to switch your function, switching locations or divisions, really raising the question what it is about promotion that's less appealing to women than to men. So I asked employees in the survey that received a 50% response rate, what best characterized their first promotion from the bottom of the hierarchy to the middle level. And you see people named a lot of different factors. Some factors have been studied by previous research, like having to work longer hours, having to work in a different environment, for example, a higher male share. But the one fact that really stands out here is having to take on team leadership. This is named twice as often as any other characteristic, is extremely salient to employees, but it has been barely studied in economics. So in the paper, I actually take advantage of the fact that I observe the universe of applications at the firm. So at each point in time, I observe each job opening an employee could have applied to, including their rich characteristics. So I can show that there's a really large gender gap with respect to team leadership based on these realized applications. In the interest of time, I'm not going to tell you anything about this, but I'm going to corroborate this result by showing you some evidence from a survey. So I designed and conducted 2 large survey waves. I invited all employees in the sample. Both surveys received a 50% response rate, and respondents are really similar to non-respondents. So first, I asked employees, what best describes where you would like to see yourself in 5 years with respect to your career progression? On the left, you see men in lower levels. On the right, you see women in lower levels. For men, I just plotted the sample means. For women, I have the male means plus the female effect. For men, the most frequent answer is wanting more pay, wanting to take on team leadership, wanting to stay in a similar position as they currently are, more challenges, more responsibility for projects, more flexibility. If you compare men and women, you see there's a really big gender gap with respect to team leadership. Women are 33% less likely to say they would like to lead a team in the next 5 years. This gap is really robust. It's not explained by key demographics. It's also not explained by individual attributes such as risk preferences, willingness to compete, or confidence. I used the standard questions in the literature and included them in my survey. These differences in reported willingness to lead a team really matter. They translate into real outcomes. So employees who say they want to lead a team are twice as likely to have applied in the last 12 months to lead a team. So this is really a high stakes gap. And when I asked different questions in the survey, for example, I asked people which workshop they would want to take, and I tell them that a firm wants to gauge how many workshops to offer. I find very similar qualitative and quantitative results. So there seems to be a really large and robust gender gap with respect to team leadership. In the paper, I do much more on this, and I think now I heard a little bit because I thought I didn't have enough time. But the last part of the paper is really about what it is about team leadership that's less appealing to women than to men. And so I test 3 hypotheses. The first is that women might have more negative perceptions of team leadership. The second is that even under full information, women might find team leadership positions less appealing because they have different preferences or constraints. And the last one is that women might have perceptions of differential treatment. Maybe they don't apply because they think they wouldn't get the position or they wouldn't be treated well. In order to test this, I asked everyone at the firm what they think about current team leaders, and I compare the perceptions of employees at the bottom and the perceptions of current team leaders. I find big gender gaps in perceptions. To get at this full information, the second part here, I ask hypothetical job choice questions. I find that key characteristics of team leadership, for example, having to work unpredictable overtime, having negative interactions with your teams or pushback because you had to tell them they didn't do a good job or you had to cancel a vacation request, and having to lead really large teams that come with a lot of admin burden are characteristics that are less appealing to women than to men. And this explains a really big part of the gender gap. However, using a vignette design, where I randomized whether I asked them about Sophie or Matthias, and I asked them whether they think that Sophie or Matthias has a high likelihood to get the job or have a good experience as a team leader, I find no evidence for perceived gender differences, suggesting that for these big team leadership gaps that I find, this really seems to be about perceptions, but also about just under full information, some key characteristics of current leadership design being less appealing to women than to men. So to conclude, in the paper, I try to provide new evidence on the determinants of the gender leadership gap. I document that a big gender gap arises early on in the job ladder as employees sort into leadership positions, really highlighting we should focus more at the bottom. I find big differences in applications that translate into realized outcomes. And that is a really important finding because many organizations right now have active application systems that require employees to actively apply to get hired or to get promoted. So if these positions are less appealing to women than to men, we may bake in additional gender differences using these systems. And lastly, I document that team leadership positions and how they're designed today are often less appealing to women than to men. This is not explained by demographics or willingness to compete, risk preferences, or confidence, but is really about the specific design of the team leadership positions. So in ongoing work with the firm, we're trying to run an RCT this fall. We're trying to understand whether supporting women when they decide whether to apply or not can actually reduce this team leadership gap and to see how it affects higher level positions. And so I think the key takeaway from this paper is that, if you want to increase female representation, you might want to think about how jobs are designed and think about how much of that actually could be changed to improve representation. Thank you so much.
Thank you so much, Ingrid. Looking forward to getting to questions at our Q&A. But before that, we'll be moving on to our next presentation. Naomi Cahn with June Carbone, women versus the winner take all economy.
Thank you. I think June is here.
Yes.
Okay. Do you want me to share screen, June?
Yes, please.
Okay. So hopefully I am sharing screen and we're going to start. I
don't think this is the right version, Naomi.
Okay.
Sure.
All right. So we'll get started and I will try to find the right version.
I thought I had changed the title. And if not, I have it.
Okay, so then why don't you go for it? All right. This is truly a work in progress, as you can see. We do know that the title of this project has changed from Shafted to A Fair Shake as we have worked our way through the publishing process at Simon & Schuster. So this is a project that is forthcoming, and we are going to turn from an empirical study to the law, and we're actually going to talk, it actually dovetails quite nicely. We're going to talk a little bit more about why women don't want those leadership positions, perhaps, as well as what happens before then.
Okay, so I like to start with two mysteries. Why we are family law professors, but this is really a corporate law project. So why are we talking about corporate law? And the answer, when we wrote our last book called Marriage Markets, How Inequality is Remaking the American Family, we discovered, to our shock, that the gendered wage gap for college graduates as a group has been increasing steadily since the early 90s. This is only recent college grads. If we did all college grads, the numbers would be more striking. And this is occurring as the gendered wage gap as a whole is dropping. So why does it happen? Well, we're going to start with Walmart. And I want to say we're starting with Walmart because for two reasons. It's one of the most interesting Supreme Court cases, the last major huge class action involving gender discrimination. And the second reason is we discovered the story at the core of Walmart is the same story we found everywhere, and we did not expect to see that. So the traditional story, Betty Dukes brings is the lead plaintiff in a national sex discrimination claim. Walmart has egregious statistics when it comes to managers. Something like over 70% of hourly employees at different times are women, but only 18% of store managers at the time the case was brought. She loses in the Supreme Court 5-4 on procedural grounds, with conservative justices essentially putting an end to statistical class actions, and in Walmart in particular saying Walmart delegated personnel decisions to its local stores. There is no national pattern, even though there are national statistics that are remarkably alike across the country. And the assumption is this is Arkansas, good old boys, they're biased against women, stereotyping, unconscious bias. But here's our story. Walmart is number one in wage theft. Paid $1.5 billion in fines over the last roughly couple of decades, almost double number two. How does it do it? Turns out all the policies that are bad for women are good for wage theft. So you select store managers who will agree to move on short notice. Managers work long, unpredictable hours. They need to fill in for understaffing. The positions are not advertised. There's a tap on the shoulder by the current managers of people they think would be good managers in the future. There's no criteria. When they recruit college grads, they prefer day students, and women, especially at lower ranked schools, are more likely to be A students than men. And they have a bonus system, a high stakes bonus system, total sales divided by labor costs and only labor costs. And if you don't meet your numbers, you're audited. And if you're engaged in wage theft, you get fired. But if you meet the right numbers, nobody asks any questions about how you do it. So let's take a look at how this is good for wage theft. Well, you want managers who don't identify with their employees or the community. By moving them around, you have national patterns, you have a national system, but without management fingerprints on wage theft. You have plausible deniability. You have a bonus system that selects for people who care more about money than about people. And you hire managers with a lack of experience because they're more likely to do whatever you want, including cheat. So that's the system. And now we looked at the rest of corporate America. And we looked at the shift from the organization man, from the organization man whose bragging rights were the size and prestige of his company, to a system where the individual bonuses are the mark of your success. From a system that promoted the long-term health of the company to a short-term emphasis on gains, from win-win cooperation, not taking risks, to zero-sum competition, and a bonus-based system that produced booms and busts. The organization man was lampooned as a wuss. He could have been a woman. The tournament valorizes competition, internal competition. And in the process, CEO to worker compensation takes off in the same period when the gendered wage gap for college graduates is increasing. How do they do it? Well, we argue it's really done the same way Walmart did it. You focus on short-term gains in earnings. You use bonuses to signal what management wants, which is often gaming the figures, but it gives you plausible deniability. You increase internal competition, which increases distrust, and you end loyalty. The company man, lifetime employment is gone. And I put this here because basically what do you incentivize? The legal way is, you squeeze, and 5 years later, the company sinks. Jack Welch manipulated earnings to make it appear the company was more successful than it was. In his 20-year reign, he met earnings expectations almost every time. Share price increased by 4,000%. But the key thing he did was this internal bonus system. It's called rank and yank. Ranks employees against each other, and the empirical studies tend to indicate such ranking systems are associated with greater self-interest and narcissism, higher levels of distrust that undermine teamwork, greater homogeneity in corporate management, less managerial accountability, more politicized decision-making, more ethically questionable behavior, and not necessarily good things for the company. So I mentioned GE's earnings increased by 300 or 400% during Welch's reign. The share price by 4,000%, but this is what happened after he left. So let's now turn to tech. We see a similar system, although quite different in business model. John Doerr, he talked about the code, very clearly male nerds with no sex or social lives. Other people say men are more comfortable painting the billion-dollar picture. In other words, pitching the unicorn to VCs. Empirical studies show that if you have the same pitch, investors respond more positively to male than female pitches. Emily Chang, what this produced, again, starting in the 90s with the dot-com boom, was a volatile mix of entitlement, hubris, and risk-taking. And empirical studies show that the kind of people are selected don't produce better results, but they do produce bigger wins and bigger losses. What happens is a boom-bust cycle, and boom-bust cycles drive out women. This is the percentage in computer sciences. And let me just note what happens. This is the dot-com boom. This is the bust. What happens during the booms? Men, white men in particular, boom, and they bust. Women stay relatively constant, but the patterns before the late 80s were men and women increased in roughly the same percentages. That's changed and changes to this day. And the men attracted by such cycles drive women out. 84% of women surveyed say they're too aggressive. 1/2 report unwanted sexual advances. 1/3 say they're worried about their personal safety. Women are 45% more likely than men to leave tech, and they cite lack of career growth and poor management. Our summary: this is a boom-bust cycle. It emphasizes growing like crazy immediately. Short-term results are what keep you alive in the context of venture capital funding, and the people who are attracted to such environments, well, they tend to be shallow cads. And let's go to finance. Again, I'm summarizing extensive research, but the most striking thing we found was in finance. 1 in 13 US financial advisors have a record of misconduct. Men are 3 times more likely to be engaged in misconduct. They're costlier to their employers, but women are 20% more likely to lose their jobs, 30% less likely to find new ones compared to the men. Why? Well, yeah, women-controlled firms don't have the same disparities, but women are more likely to be fired because of complaints from an employer. Men are more likely to be fired because of complaints from customers. And men are rehired in what the authors of this study call a market for misconduct, that is, firms that care more about the bottom line than institutional integrity. The biggest gender gap in the entire country, Wells Fargo. And we have cases we follow of women who filed sex discrimination suits against Wells Fargo at the height of their fake account scandal. 25% more likely to be fired for misconduct than men, even though there's no indication women were more dishonest. So, our conclusion. This is an economy where those who can break the rules and get away with it can win really, really big. And such an environment creates what we call the triple bind: intense competition, selection for narcissism, that intensifies the old double bind. You have to be able to break the rules and get away with it. Fewer women apply for these environments once they acquire reputations of being negative experiences for women, creating a triple bind that reinforces the male dominant, and again, male in terms of masculine norms of competition environment. There's wonderful studies on masculinities contest cultures that document in an empirical way a lot of what we're describing. And the final point, sex discrimination suits that in the old days, in cases like Walmart, were an impetus for reform, no longer are. Mandatory arbitration and non-disclosure agreements sweep it under the rug. Sex discrimination is simply the cost of doing business. And whistleblower claims today are likely to accompany sex discrimination claims. End of talk. Thank you.
Thank you.
Thank you so much. Again, can't wait to get into the Q&A so we can have further discussion. So again, for folks just joining us, and if you didn't hear what I said at the top, feel free to send in your questions through the Q&A on a rolling basis as they come to mind, so that we'll be ready when we open it up to the question and answer time of our session. With that, I'd like to pass it over to Martha Bailey for a presentation on MCARE's, the Michigan Contraceptive Access Research and Evaluation Study.
Hi, everyone. Thanks so much for inviting me to attend this really cool session. After the first two talks, I have the sense that my paper is one of those that's like now for something completely different. So we're going to be talking about a lot of the things that go into women kind of showing up in the workforce in the first place. A little bit less about what happens to them once they're there, and sort of the nature of those environments. As is the first in what I hope will be a long series to grow out of the Michigan Contraceptive Access Research and Evaluation Study. I know that's a mouthful, but we call it MCARES for short. And there are a whole lot of collaborators. I won't be able to mention them all, but a lot of people from different disciplinary backgrounds: sociologists, people in public health, people in demography, and OBGYNs, in addition to our field operation at NORC, and also a wonderful collaboration with Planned Parenthood has made this study possible. So let me just start with the observation that almost half of US pregnancies are unintended. That was the last time we measured in 2011. Those numbers haven't been updated in a while, and I suspect they're a little lower now. But the other thing that's happened over time is that the correlation of poverty with the rate of unintended pregnancy has become even more striking. So you see this fanning out, where women who have the lowest incomes in the economy are also disproportionately likely to have an unintended pregnancy. And while rates have been falling, not just between 2008 and 2010, the last time these numbers were updated, they are falling less quickly among some of the poorest women, the most economically disadvantaged in the economy. So thinking about how to move the needle on this is something that has been a major source of contention between economists, sociologists, demographers, people in reproductive health for over 50 years. And there's not a lot of great evidence on what we can do from a policy perspective. One of the things this study set out to do is investigate this in the US context using a large-scale RCT at Planned Parenthoods. Our question is we're really going to focus in on one of the explanations for why low-income women don't use highly effective contraception, especially, which is especially important now in the wake of the Supreme Court decision reversing Roe v. Wade. So we're going to focus on financial access to contraception, and we want to know how this affects women's choice about contraceptive method, but also their future pregnancy and unattended childbearing. But I'm an economist, and together with my team, we didn't want to stop just thinking about changes in the utilization of contraception and unintended pregnancy. What we're really after is understanding a whole host of downstream outcomes that happen because of women's fundamental biology that puts them at risk of pregnancy without reliable contraception. We're interested in their attitudes about and the use of reproductive health care, their physical health, both in the short term and the long term, their educational attainment, their labor force outcomes over time, the quality of their relationships, not just whether or not they're married or partnered, but how good those relationships are in terms of things like intimate partner violence and financial stability, their mental health, overall well-being, their participation in a number of government support programs, and also we're interested in following the outcomes of their children. Today, we're just now about 4 years into the study, and we have the first evidence on changes in take-up of contraception, so I'm going to focus on that. Let me tell you just a little bit about the study design. The first is that we use individual randomization of vouchers to cover the cost of contraception. This is any out-of-pocket cost of contraception at Planned Parenthood of Michigan clinics. Individual randomization is really important here because that's going to allow us to sidestep concerns about differences in provider care. For instance, we know that doctors and clinics in a lot of these contexts make a big difference for what types of contraceptives women choose. We want to abstract away from that. So that's not going to be in our estimates. We're going to be individual randomizing at the individual clinic or individual level across multiple clinics. The second thing is that this is the first study that's not going to put any restrictions on the type of contraceptives that women can use. So there have been studies in the past that make, say, one type of contraceptive free, but not others. This is a little bit harder to implement or maybe even silly to implement or think about implementing on a broader policy scale. So what we're doing is giving women money that they can spend against any contraceptive in the clinic. And for women who choose long-acting methods that also cost for the removal, we subsidize that within the first year to make sure that they're not financially constrained in their ability to not use the method if it's not the best one for them. The second thing we do is we follow participants over time and we compare the outcomes of those who received these vouchers in the treatment group to the control group. And we do this both in follow-up surveys. We're currently fielding our first follow-up survey and also in administrative data. And by administrative data, I mean information on contraceptives that they bought from Planned Parenthood clinics. We have Medicaid records. We have consent to link to census records, IRS tax records, and a whole host of other types of things, which is going to really help with attrition over the long term and also measurement error in surveys. For instance, women don't like to report on surveys that they have had an abortion, right? This is very taboo. They don't report it, so it's really difficult to measure. We have information about whether or not they received an abortion at Planned Parenthood through our medical records that we can use to supplement those surveys. So there's a number of things like that this allows us to do. The MCARES intervention is extremely simple. We approach women in the clinics of Planned Parenthood waiting rooms. Before the appointment, they're screened based on some simple eligibility criterion, including age, whether or not they have out-of-pocket costs for contraception, and whether or not they're able to and at risk of getting pregnant. If they are eligible, we ask them if they'd like to participate. They read through a consent form, and at that point, if they agree to participate, they're randomized into the study. And half of the eligible respondents get a voucher for contraception that they can use for any contraceptive and related surveys, related services at Planned Parenthood within the next 100 days. And the rest of the appointment proceeds as planned. So our field interviewer in our study doesn't go anywhere behind the scenes. We're not in the back of the house in the clinic, just in the waiting room. The control group just gets the usual standard of care and pays usual prices at Planned Parenthood. So there's two parts of our two phases to the study. In the first phase, we give women a voucher equivalent to 50% of the out-of-pocket costs of a name brand IUD. And then the second phase, we give women a voucher for 100% of the cost of the IUD. And again, we're trying to test how price sensitive are women. Does it really matter how much we subsidize contraceptives, not just whether or not they have a discount. So let me get right to the results. We're going to be doing very simple comparisons. There's some regressions running in the background, but really you can just think about this as a comparisons of means. So the first question is, how does reducing out-of-pocket costs change the women's choice of contraceptive methods? So to be clear, these women are uninsured, so they have out-of-pocket costs. They're above the poverty line, and they're between the ages of 18 and 35. If they were not financially constrained in terms of their choices at Planned Parenthood, if we give them a voucher, we wouldn't expect it to affect their spending. In fact, it does. If we give them the 50% voucher, it increases the share that use or choose to purchase any birth control by about 28%. It increases the contraceptive efficacy of the methods that they choose by about 28%. It increases the share that are using long-acting reversible contraceptives like IUDs or implants by 76%. And it increases the duration, the number of days that are covered by the methods that they choose. For instance, a pack of birth control pills, that would be counted as 30 days. An IUD could be, upwards of 3 years or even more in some cases. That's what this contraceptive duration is. It increases that by about 91%. Now, when they receive the 100% voucher, making any contraceptive up to the cost of a name brand IUD, you see that these numbers increase across the board, as you might expect if they were financially constrained. Significantly more women are purchasing birth control. Efficacy of the methods they choose increases by about 42%. And here's a really interesting nonlinearity. When you make the price of a name brand IUD, you make it half price. You see that 76% increase. But when you make it free to women, you see an increase of over 300%. So these women are extremely price sensitive. Making IUDs and implants half off means that women are still extremely financially constrained. They're not able to purchase them unless these are much less expensive. You also see a big increase in contraceptive duration. So how do these responses vary across population subgroups? We do a lot in the paper on this, but I'm just going to abstract away from some of that and give you a couple of highlights. Well, the first, I'm just going to focus here on LARC use because that's the one where we see the most price sensitivity, which isn't surprising because those are the most expensive methods. The first thing you see is here, you see that non-linearity I was discussing on the last slide across all of these different groups. So for women overall, for white women, childless women, women under the age of 26, over the age of 26, that's the median age, women who have less than an associate's degree or an associate's degree or more. So we see very strong effects for all of these different groups. One of the groups where we saw a staggering effect here was for mothers, and that was a little bit surprising for us. Here, if you make those IUDs free, those LARCs free, it's going to increase their take-up by 1,200% relative to the control group mean, which is just a massive number. The other really interesting finding here in the subgroup analysis that making LARCs free does not increase take-up among Black women in our study. Now, what this doesn't mean is that it doesn't mean that Black women are not financially constrained, but what it does mean is that there are other barriers to their take-up, which have been documented elsewhere in the literature. A third question here is, do the costs of contraception shift women's, quote, desired method? And this is another big point of contention, I think, between sociologists and economists and demographers. So what does it mean when women say they want to use a particular method or they don't? And how do we think about that? So what we did is on the eligibility survey, when they first came into the clinic, we asked them which method they planned to use that day. So they're sitting in the clinic, they've made an appointment, we asked them which method they're planning to use. So for women, and also which method they're currently on. For women who are not using a long-acting method at the time of enrollment, you see those effects are pretty much very similar to what we see for the population overall. For the women who were not planning to use a long-acting method, so they're sitting there, they tell us they'd like to use birth control pills, or they are to get Depo, did receiving a voucher change the likelihood that they purchased a LARC and had it inserted within the next 100 days? And the answer to that question is yes. So these are for women who weren't planning to get it. Giving them a voucher, making these contraceptives free had a very large effect on which method they chose. And here's another really interesting finding. For the women who were planning to use long-acting methods, an interesting finding is that only 1/3 of them followed through on that within the next 100 days. Now, receiving a voucher that made that free to them, that choice free to them, doubled the likelihood that they would follow through. So it increases that number by around 100%. And the remaining third of the gap between what they said they planned to do and what they actually followed through on is not explained by financial barriers, but may relate to other types of things. Maybe they decided it was this was not the method for them based on a consultation with their physician, or maybe that there were other barriers for them. So let me sum up. These are very large effects, and I just want to highlight a couple of things about the study that are different than what we've seen before. The first is that we think there's very strong internal validity here. We're using the gold standard of a research design, a randomized controlled trial. That's not something we've seen in the literature before. I've contributed a lot in terms of quasi-experimental evidence, and I think we have pushed that a long way, and that helps us a lot. But it's very nice to have a randomized controlled trial to really underscore that these are indeed causal effects, not a spurious correlation. The second thing I'll emphasize is I think that there's a lot of importance around a lot of external validity here, which may sound like it's a very strange thing to say about an RCT because that's usually a limitation. So bear with me. One of the things is that all of the quasi-experimental evidence that we have on the importance of cost to contraception as a limiting factor, or access being a limiting factor for women, comes from the era before the Affordable Care Act expanded health insurance coverage and also its mandate for the coverage of contraception, right? So if you think about Colorado, if you think about my work in the 60s and 70s and the expansion of the birth control pill, that's all from a very long time ago. So if you want to know how much the cost of contraception matter in the current policy context, those studies really aren't that informative. We think this one is, because this is conducted right in the middle of this period. Another strength is that we can look at long run effects. I haven't been able to show you those today, but we're going to follow women for 30 years and not just consider the effect of vouchers for contraception on their take-up of contraceptive methods. We'll also be looking at pregnancy outcomes, childbearing, education, career progression, etc., for some time to come. Another strength is that we think that this is a really simple policy lever. And by simple, I mean, we don't have to go in and revamp the way clinics are structured. We don't have to change the way doctors are trained. We don't have to change counseling or do all sorts of other things that take quite a lot of time and effort and are very difficult. In fact, the lever that we could just change pricing for Title X clinics through the Title X program, and that would be sufficient to implement this on a national scale. And finally, we're the first study to really look at subgroup heterogeneity and the local average treatment effect of these types of pricing changes, because most quasi-experimental studies are intention to treat in nature. So there's a lot of big effects here. I won't go through them in the interest of brevity. I'll use my remaining time to just talk about two potential limitations that are on your mind, and I think are important to kind of keep in mind when interpreting this. The first is that we're looking only at women who show up at Planned Parenthood lobbies, right? These are women who are seeking care. And at first blush, you may think, oh, wow, this really isn't a particularly informative group to study. And I think we think this is less of a concern than most people who kind of think about this at first, and here's why. One is that care seekers are a really, really important population. These are women who are going to get contraceptives and do not have the ability to choose the one that they want because they are financially constrained, right? So changing financial constraints for this women could really move the needle a lot. There's about 3.4 million women who lose Title X in 2018 before Trump cut the rules. We know that the number is lower now, but the women who we think would use Title X there are quite a few here. The other thing is that there may be some general equilibrium effects here that probably go in the direction of increasing the effects further. For instance, if you think that having access to free contraception could change women's willingness to go to a clinic to take up contraceptives, we think that this could further move the needle on things. The second is that you might think we conduct this study in Michigan. You might not think that's particularly informative for the US overall, right? The demographics in Michigan are different than overall. So we use a reweighting strategy to try to reweight women in Michigan to look like the national sample of women who are in the same age group and roughly the same income brackets. in the National Survey of Family Growth. And when we extrapolate from our sample to that national sample, we project that implementing this on a national scale would reduce the number of pregnancies nationally by about 5.4%, birth rates by about 3.5%, and abortions by about 8.1%. That was prior to the reversal of Roe v. Wade. So the effect on birth rates, you might see some changes in the in those numbers sort of in the aftermath. So let me stop there.
Thank you so much, Martha. Following your presentation, we have our discussant, Christine Durrance. Hopefully I pronounced that okay. So I will pass it on to Christine.
You guys see my slides? Okay, great. Martha, thank you for an
You
exciting—
can see it in presentation mode. I'm not sure if that's the way you want to show it to us.
Oh, let's try again. Hang on. Sorry, folks. Just running the class. Let's try again. No, I can't see it. All right, let's try one more time. I closed it and reopened it. Yes?
It's still in presentation mode. You might have to, oh, there, that works.
Is that better?
Yeah, you got it.
Okay. Nothing like technical difficulties after years of using Zoom, right? Martha, thank you for sharing this paper. This was a super fun paper to read, really timely, a lot of interesting results that Martha didn't have a chance to show you. There's actually a lot of empirical stuff going on in this paper, but I think you all got the big takeaways. I just have a couple of big picture things that you all just heard. What I think is most interesting about this paper is that the research question sort of sets out to say, how do out-of-pocket costs affect contraceptive use? And I think really the research question is, how do subsidies affect the use of LARCs for low-income women in a post-ACA, pre-COVID, pre-DOPS environment, right? Because there's a lot of sort of caveats on this time period that's really unique to what's going on in this MCARES study. I think this paper, and now that I know there's like all of these other cool things that are happening going forward, I think everything I have on this slide is like even more important, but is really significant for a number of reasons. I think understanding price sensitivity and method choice is exactly the kinds of questions we want to be asking ourselves right now, especially thinking about the high concentration of unintended pregnancy among low-income, uninsured individuals. I think this is also a good thing for us to be thinking about as we continue thinking about policy implications that promote reproductive equity and reproductive justice, the ability to make decisions regarding when to have children and under what circumstances. And we know that family planning affects all sorts of things that Martha and her team are going to study going forward, and of course has big implications for public costs, Medicaid, and social welfare participation. So I just wanted to say a couple things about LARCs, and in doing that, I wanted to bring up sort of my last bullet point. So LARCs have been historically underutilized with some increase over time. And we know that we have some information about how large-scale LARC programs that are a little different from the RCT described in this study have impacted teen fertility. But now we see some other studies going on to ask questions about education and other things associated with reductions in teen fertility. But there's also sort of a history of coercive practices among low-income individuals or people of color that are worth just acknowledging in this context of having greater access to LARCs. And I'll come back to that in just a second. So I have some questions. So one of the questions that I have is about the counseling that happens. This is a really nice RCT, so there's not a lot of like methodological questions because the design is so nice. So my questions have to do with what the counseling looks like. My understanding from the paper is that the counseling at the provider level is really about effectiveness, but based on the way the voucher is implemented, I think there must have been counseling on how much this would actually cost an individual once they decided what they wanted to pick. And so I was curious a little bit about that to make sure that that counseling on cost didn't sway an individual with the kind of the kind of contraceptive that they would uptake. And with that in mind, the voucher has to be used within 100 days. And the voucher is either 50% or 100% of the lowest cost LARC available. And so I wondered, and this may be totally off base, but I wondered if the nature of the voucher might incentivize LARCs above and beyond its actual cost. So in other words, if I have this amount of the voucher and I can get a LARC, or I could get, for example, 3 months within 100 days of oral contraceptives, do I lose effectively the remainder of what I could have spent on a LARC? I don't know if this makes sense, Martha, but I'm thinking like, if I have access to this voucher's worth of money, maybe I'm more likely to pick a LARC because I am going to get more for what I'm being given from a public perspective. And that might change the way that I think about the offer. The other thing that I wanted to just offer, and I think Martha sort of suggested this in her presentation, because there has been criticism of LARCs and sort of a spectrum of what might be called coercive methods or coercive advising, I think it's interesting to think about the results with respect to Black participants in the study. So everyone was given equal information about the effectiveness of different methods. And I wonder if maybe the lack of response from Black participants to the voucher might have something to do with trust with the medical system or sort of prior feelings about coercive practices that certainly have surrounded some discussion of LARCs in the past. And then I really wondered about big questions we're having these days about postpartum LARC insertion and how to think about maybe the policy experiment that you do where we say, what if we give everybody 100% access to contraceptives or 100% access to LARCs, how that could potentially compare to a program that would get everybody postpartum LARC insertion at 100%, because I think you see a really large take up in your data for women that have a large number of births, 3 or more births. And then I think this is really just such an important study to be thinking about in the wake of the Dobbs decision and thinking about sort of heterogeneous access to contraceptives and effects. And I think it might be worth, you talked about this in your presentation a bit, thinking about the role of abortion access across the states. The introduction of the paper is sort of motivated by the demand for and the supply of contraceptives. Some of the analyses are stratified by beliefs. So beliefs about contraception, beliefs about religion, could also be beliefs about abortion. And I think it could be interesting to think about the policy experiment that I just mentioned, where free contraceptive access is given to all uninsured Title X users. And we could think a little bit about how this would necessarily vary as we think about sort of abortion access changing across the states. So I'll stop there. Sorry if I went over time. Thanks for sharing this with me, and I look forward to seeing the next iteration.
That was great. Perfect timing. Well, thank you everyone for your presentations, and thank you, Christine, for your discussant remarks. We will now turn towards our Q&A part of the session. So again, if you have a question you'd like to ask the presenters, please feel free to submit it into the Q&A box. And if you can include your name and affiliation, we can give you proper credit. I will actually turn it over to Martha, because I'd love to hear, Martha, if you have any responses you'd like to share, given Christine's remarks that she just gave.
Sure, thanks. And thanks, Christine, for your really careful comments. Let me see. One of the things that's difficult about working with a healthcare provider, I guess you asked us about counseling, is that one is it's really difficult to find out what they talk about back there, and they don't let other people in there for a number of reasons. And two, I think it's not sort of a standard, it's a different person at every different, at all of the different clinics we consider. So I suspect it varies a great deal. But usually the counseling, what we've been told is that the counseling is just, you kind of sit down with women, you talk through the different options. They have a standard, CDC sheet talking about the efficacy of different methods and side effects and those types of things. And they're also asking about women's different kind of needs and hopes, for what they're looking for that day. It seems to me that there also has to be some discussion of price, because of you cannot finance IUDs. You have to pay out of pocket in cash the day of. There's no I'll pay you later, insert it now, because they know they can't recoup their costs. So there are a few funds that they have in the background that they've also used to, I should say, undermine our RCT. So they're subsidizing the control group a bit, but for the most part, we don't have a lot of information about what happens with the counseling. So all of those things are likely happening. And to the extent that it enters that the voucher is a consideration, which I believe it would be for most people making a decision about something expensive to purchase. I think that matters. That's one of the reasons why we wanted to give it to them before their counseling. So if you go in there, it's essentially free to you, then you're free to choose any of these things. The other thing you mentioned is a little tricky. And I think you were trying to get at loss aversion, the idea that I'm giving you a certain amount of money and that you won't necessarily spend it all if you don't want certain types of contraceptives. That is an issue. We don't know how important that is. We don't actually think it's that important. But one of the things that, but women can walk out of Planned Parenthood with up to 12 packs of birth control pills, right? Which would totally tap out their voucher. They can also return for 2 depot shots. That's why we made this 1 month apart, right? So they could get them 90 days apart. That would cover around 6 months of their year. And we also put a deadline on it, because we know in these types of studies that when you don't, that people forget about their voucher, they lose their voucher, they procrastinate, all of those types of things. So we wanted to make this kind of a salient thing. And also just for study accounting, you have to have a day when you close. You close off the voucher that you gave. So we were trying to keep it as flexible as possible. And we weren't trying to nudge them into using any particular type of contraceptives. That said, we know that, we would expect to. So if you wanted to use birth control pills, you're not going to be nearly as financially constrained as someone who wants to purchase a long-acting method like an IUD, simply because they're a lot more expensive. You have to pay out of pocket for the whole thing. You cannot come in every month and get another pack of pills, or every 3 months. So we do think that, and in fact, reducing financial constraints is really going to affect those big out-of-pocket, those fixed cost types of expenditures. Let me say just a bit more about what you said. I think you're absolutely right. And I hope that we said enough in the paper. We didn't want to go into a lot of detail. People will call it medical mistrust. I'll call it medical abuse. We have a long history of that: forced sterilization, eugenics, racist abuse of women in a variety of other contexts. That may be part of the issue. The sort of the legacy of that treatment spills over into discussions with people's medical providers, especially using these more medical technologies that require procedures. So that might be a big issue. It could also be just about preference. We really don't have a lot of information about that. That's not coming out of our study. So I think that's one of those follow-up studies that we'd like to do a lot more of in the future. And I'll stop there. But thanks a lot. If there's something I didn't get to, just feel free to follow up with me.
Thanks, Martha. I actually have a question that I'd like to direct to Ingrid. Ingrid, what do you think is the external validity of your findings to other firms, to other industries, and across roles? I'm sorry if I missed if you spoke to the different roles at the firm and how that might change in terms of your results.
Yeah, that's a great question. I think, whenever you use firm data, it's fantastic because you have so much data, but you always have to ask yourself if this is, a specific setting. So I think when it comes into the broken rung, there's actually increasing evidence that these early career steps are really important. So the McKinsey study that I mentioned, they have 10,000 firms in the US and they find kind of similar results. They don't know why this happens, but I kind of find that the biggest drop off in representation occurs early on. The other studies in economics, it's difficult usually to measure hierarchy. So people often focus on very specific occupations like bankers, academics, supermarket workers, and they find very similar results. There's something really big going on at the bottom of the firm, of the job ladder. The nice thing in my setting is that this is a large multinational firm. It's a manufacturer, so most jobs are engineering positions, but there's a lot of like marketing, sales, HR. The firm has over 200 typical occupations that are both male-leaning and female-leaning. And I didn't have time to talk about this, but I find really robust gender gaps across these different areas. So even if you're in a team with a female supervisor and a female-leaning function, there are really large gender differences. It's a multinational firm. For this paper, I focused on Germany because it's the biggest internal labor market, very nice data, but I find very similar results looking at other countries like the United States, like Mexico, like France. So it seems that, this gap and like how leadership positions are designed seems not to be just specific for this context, but usually it's really difficult to measure. So there's a lot of other data out there.
That's really helpful. And I just wanted to follow up and understand these leadership positions in terms of how they were being described, or do some of your results also show that maybe we're not describing all the facets of what leading a team entails?
So you mean at the moment when people apply, or in general how people learn about leadership?
At the moment when you're seeing the application differentials, or at any period of time, if given that leading a team, I think, has a lot of different components to it, some that are attractive and some that are more challenging. And so do you think that some of your results are also showing that maybe we're not describing what that role could actually look like in practice that could potentially be more attractive to women?
I definitely agree. So like when I did focus groups, a lot of women said, I thought that I wouldn't like leading a team. I thought this is very male dominated. And then I realized you have to be good at communicating. You have to be a team player. You have to be empathetic. Maybe women are better at this. In the paper and in the surveys, I try to really get at this. So I asked people what are the most and least appealing features of leadership. And the three things that really stand out is having to lead a large team with a lot of admin burden. So you don't get to do your original job. Everything you do is basically, thinking about vacation requests, restaffing, stuff like that. It's like pushback by your team or negative interactions, having to sit someone down and say you didn't do a good job, or you can't go on vacation, and unpredictable overtime. So almost everyone in my setting actually works full time. So it's really not about part-time versus full-time, but it's like having to be constantly available. Women are actually not that, it's not true that they just get it wrong. They have, they're super, there is misperception. Women have more negative misperceptions, but the biggest thing seems to be that even under full information, these are characteristics of leadership decisions are actually less appealing to women than to men. So unfortunately, it would be easier if it's just about information and we tell them this is how leadership looks like, oh, you totally overestimated this. Women have more negative perceptions, but it's much more about that there's specific key features of leadership that are less appealing to them. And that could be consistent with differences in preferences or constraints. Maybe women pick up their kids. And so for them, unpredictable overtime is like a much more binding constraint. I don't want to really, I'm pretty agnostic about this in the paper, but I think what I would like people to take away with is like this design that we have in place in many organizations is less appealing to women. And so if we want to increase their representation, we may have to start a conversation about how leadership could be designed to make it more appealing to women and not just tailored to men.
Great, thank you. I'd like to move some questions over to Naomi and June. Naomi and June, you talk about a little bit about the masculinity contest culture as zero sum, and it sounds like this very vicious fight. I know it can be defined as you've defined it as men competing at work for dominance by showing no weakness, demonstrating a single-minded focus on professional success. those types of characteristics. But I'm wondering in your study, if you found that all men or individuals who partake in the system are actually very active in this vicious fight, that perhaps there's also individuals who acknowledge that it's happening, and then they don't push back, or they just take advantage in less, I would say, some of these characteristics, aggressive ways, which allows them to advance in a different way that I think the contest culture makes it sound like all individuals in the culture are playing. So I'm just wondering if, when you were thinking about this, if there are different roles you find in this contest culture that individuals are playing, or if when you were looking at the data and these claims, you weren't able to actually elicit that from your exploration.
June, do you want to start?
Sure. Let me emphasize the one way in which our work is different from the masculinity contest culture work. So that describes how traits of masculinity, when they take hold in the workplace, become self-reinforcing. We start, and the Walmart example is designed to illustrate that you often have put in place workplace selection processes that pit people against each other in order to have plausible deniability. You get what you want without management fingerprints being on the result. So if it's illegal, if it's wage theft, if it's earnings management, which is securities fraud, if a variety of things get you in trouble, this is a way of incentivizing those things without management being responsible for them. We argue when you have that, and you tend to have it be pretty dominant in finance, certain kinds of corporate cultures, like Walmart, and tech in a different way, where it is, the drive to get up and running and fast, no matter how many people you have to run over. When you have that, you're going to select for these traits. So it's not that these traits are there in men and they cause these environments to take hold. That's how we read masculinity's contest cultures, as an unintended byproduct of masculinity. But we argue this is a design feature, not a design flaw. And it then will select for people, not women as well as men, with these traits. And these traits will drive women out, largely because women can't get away with it. They will be, Carly Fiorina is our poster child for a woman who embodies these traits. And she is vilified in a way very few of the men who do the same thing are. And so it tends to be that this will produce a male-dominant environment, but not because boys are being boys and left to their own devices, they inevitably produce this, but because these environments, which are engineered to produce certain results, will select for men with these traits to the disadvantage of women with these traits.
And I'll just add, as when June started, she said our work is different from others on this panel.
Yes.
We are looking at, we're lawyers. We are not, we're not economists, sociologists. So our data, if you will, we're relying on other people's studies, and we are also, our original data are court cases where we are finding all of these happening. I will say that there's a wonderful, for example, Journal of Experimental Psychology article, Masculinity Contest Culture Reduces Organizational Citizenship Behaviors. I mean, there are studies of how masculinity, the framing of a culture as a masculinity contest culture actually affects people. And as June said, it's not, although it's called masculinity contests, it's the masculine as opposed to men, women, gender non-binary people. It's the culture itself that we are looking at. And there are other people's actual studies of experimental conditions in which setting up this culture does exacerbate the kind of competitiveness that we have found as we have sifted through hundreds of court cases and read thousands of pages of documents of these court cases, looking to see how these cultures are set up.
That's very helpful. Thank you for that clarification. And June, I know you had mentioned the tech industry being slightly different. Can you again describe what are those slight differences between the tech and the finance industry that you found?
The key thing is that tech, we have different parts of tech, an examination of VC world and startups. But when you look at startups, startup culture has these traits without it being illegal. So think Uber. You get the dominant guy who is out to create the unicorn. And what is incentivized is growing like crazy as fast as possible. So you get funding with very few strings attached, but the key thing you got to produce is growth. Now, take a look at Elon Musk, and we use Elon Musk, our introductory story, is he combines, a really cool idea at Tesla with an internal culture designed to overlook product defects in order to grow like crazy. And then we have the stories of a woman caught up, she gets a job as an engineer without any engineering background because she puts in a 26-hour day, and they're so impressed with her. They promote her to an engineer, even though her background is in the biological sciences, and she came in with knowing nothing about cars. But when she complains about product defects, she is pushed aside. And what she describes is a whole lot of sexual harassment, other kinds of harassment taking place in her job. But what gets her fired is complaining about the product defects. And our argument is, again, when we're looking at tech, that often these things are not illegal. I mean, product defects maybe, but a lot of it isn't. But it's an environment because of the emphasis on growth that is going to select for these guys, young men in their 20s, who will put in these incredibly long hours and who will care more about the bonus or the stock options than about getting along with your coworkers.
Glad I never went into tech. No, I'm just kidding. There's a lot of great things that are happening also in tech.
Yeah.
Thanks for going through that and helping clarify the story for me and for those who are listening as well. Naomi, I wanted to pass it to you. I know you have a question for Martha, so we can have some also internal engagement before I pass it on to Q&A with the audience.
I mean, I just have to say, I'm delighted to be on this panel with people whose work I really admire, including Martha, yours. And one of the questions I posed in chat was how we can find your paper, because I just went on the Michigan Cares website and couldn't find it. But I guess I had a couple of questions in terms of putting your piece, sort of like how you, and I assume you do this in the piece, you compare more fully what you found with the WashU and Colorado LARC findings in terms of those studies. And then I'm also, I mean, as you noted, these were, I think all of the vouchers were distributed at the PPMI clinic. And, sort of, I'm very interested in all the policy implications for how we do this more broadly. I should note I'm teaching both an after Dobbs course and a poverty law course. So your paper is relevant to both.
Sure. So let me comment a little bit about I think the two most related studies that have been recent. You're thinking about the CHOICE study that took place in St. Louis, and you're also thinking about the Colorado, the work on the Colorado Family Planning Initiative, correct? Yes. Okay. So let me just point out a couple of things. So the first is the CHOICE study recruited women, including from abortion clinics, but also reproductive health clinics. And as part of their recruitment into the study, offered them, one contraceptive for free. This could have been a LARC, one pack of birth control, all sorts of things like this. There was no comparison group built into the design. So what they did is, after having selected women who were interested in using contraceptives, they compared them in a variety of contexts to population-based samples over time to study the effect of these things on pregnancy. Now, you might have expected, I would have expected, in the absence of any difference in access to contraception, that women who are recruited either at an abortion clinic or seeking family planning services would have very different preferences for the use of contraception than, say, the population at large in St. Louis, even if it otherwise looked very comparable. And that's not something they could control in that study at all. So in terms of its internal validity, I think economists and people who think a lot about research design have a lot of concerns about that study. It doesn't mean it got the answer wrong. It just means we don't know from what that design looked like, right? They did the best they could with their study, but we just don't know. The Colorado Family Planning Initiative is different. There's been a lot of really great quasi-experimental work on that, including some papers that I very much like. That study took place prior to the expansion of the Affordable Care Act's expansion in health insurance, and also its mandate to cover contraceptives. So one of the questions there is like, well, we're in a new world now. And so when we first started the MCARE study, Planned Parenthood, a lot of policymakers, they're like, cost is not an issue. People at Planned Parenthood pay on the sliding scale, right? They pay on the sliding scale, which means that it's affordable for everyone. And people with insurance, they all have access now. People below the poverty, and we've expanded Medicaid and a lot, all of these other things, right? So this cost is just not the issue. There's got to be other issues like preferences or physician counseling or the way we're structuring all of these other things. And I don't want to say that those things aren't important, but for me, I thought, well, paying $1,000 out of pocket for an IUD for women who are sort of near poor is a really substantial outlay, right? You're choosing between rent and sort of contraceptives, and even if it's highly subsidized, a couple $100s is, that's your groceries for the week. So just kind of thinking through, this is a lot of money, and then a lot of people, of course, are saying now they're like, wow, half of women who seek abortion in the United States are below the federal poverty line, right? So those abortion patients, they tend to be very, very poor. And so people say, well, why don't they just use contraceptives? Why can't they get those? Well, one of the reasons I think that should be clearer, at least in the national policy discussion, is that these are extremely expensive. This is a group that it tends to be uninsured or underinsured. And so there's some very easy things we can do from a policy perspective to move the needle on that and reduce the demand for abortion, given that we don't think, at least my personal opinion, you're at law school, I'm guessing you know a lot more about this, but my personal take is these things aren't going to be reversed in the very near future. It's going to take some time for us to change those policies.
Thank you, Martha. Oh, please, if someone was going to respond.
Oh, well, can I follow up with a question to Martha, or do you have somebody else?
Oh, please go ahead. We still have time.
So I've been fascinated in our looking at this about two things. I wonder if you encountered them. One was hearing stories, especially from teenagers, about how people who regularly see a doctor, that the doctors are making a point of saying to adolescents, you need to be on the pill. It controls acne, makes menstrual cramps more regular and easier to deal with, etc. And whether that, but I haven't seen a comprehensive study of that, and I'm just curious about it. The other is Jennifer Barber's research. Jennifer. Yeah, so we've had her out here. We did a whole workshop on her findings for family law professors, and the role of violence in undermining contraceptive use. And whether that comes in, have you looked at that? Do you have anything to say about it?
Well, Jennifer is one of the people who, she was with me at the University of Michigan when we launched this study. She's also part of our study team. And in part working with her, she got us to think a lot more about the survey questions we included, including like, what does intendedness mean? What does it mean to want to avoid a child? And we're talking about sort of the degree of preference, not just like a binary type of outcome, which is typically asked. We also have really detailed questions about intimate partner violence, relationship quality, again, kind of motivated by this idea. So even if contraceptives don't change a lot of other things that are going on for you, they could change who you're with, who you have a child with, and that could be really, really important for women's well-being. So we think that those things are really important, and we are excited to study them, though we have not yet. We're still recruiting, actually, because with every policy change, there has been like a new study phase. So I just showed you the 2 that are complete. Then we withdrew from Title 10, another phase. Then we had COVID interrupts everything. That was another phase. So we're still going. Now COVID kind of interrupts everything, but not really as much. So it's been kind of a crazy thing from that perspective. In terms of the counseling, I think that's a really important part of the story. Planned Parenthood is different than a lot of other providers because they have systematized a lot of things like that. And I don't think that type of counseling skew is as prevalent at those clinics as it might be sort of more broadly, though I may be wrong about that. I think because they actively try to give women a wide array of options. But again, we don't get to go into that counseling room. We don't know what's said. And yeah, so this could be a really important thing. And yes, I have heard accounts like that. I think they're much less likely to put, I guess, nulliparous women on things like IUDs to begin with, and that could be part of the counseling that's influencing outcomes.
Thank you.
I'm going to pull Naomi back into the conversation, so feel free, Naomi, to come off mute.
Well, I kind of following up on that. Yeah, I was so thrilled to see Jennifer as one of the co-authors when you flashed up that title slide. When are you also keeping track of who accompanies your participants to the clinics? That kind of builds on this question of maybe not violence, but sort of, I mean, sort of relationship, et cetera.
We do. We know who's there with them. And we also ask them a set of detailed questions about how their partner feels about their use of contraception. Has their partner ever engaged in any kind of, have they put holes in condoms, or have they threatened them for using contraception? Or, we ask them about their partner's preference for pregnancy and these other types of things as well. So we are trying to get at those things as much as we can. There aren't many cases where a significant other accompanies women to come to Planned Parenthood. They tend to be alone. The exception to that is when their English skills are not particularly strong, in which case they might bring another family member or friend or something like that to help. But that has not been, we were thinking a lot about that at the beginning of the study, but that's not in fact what we see. And that may simply mean that type of coercion, intimate partner violence takes place before, and those women just don't come to the clinic.
And what about minors?
Oh, minors aren't in our study. So we are only recruiting women who are 18 to 35. There were a lot of other IRB issues around recruiting younger women. And so we really didn't focus on them.
Martha, you still have a couple more questions coming up. I'm pulling them from the Q&A. It's a moment that.
Thanks everyone for your interest in the study, though. I'm happy to defer some time for the other speakers as well. I don't want to take away.
Well, we'll get to hopefully these last two, and then I'll just ask a general question for everyone at the end that will go around the horn before we're up with time. So Martha, what do you think caused the relatively sharp decline in unattended pregnancies for women that are 100% to 200% of the federal poverty line when you measured in 2011? The questioner asked, this seemed counterintuitive given economic conditions and pre-ACA implementation.
Right. Well, I think that's a really big question. And what we know from some of other work by Casey Buckles and Lucy Schmidt and Melanie Goldie is that pattern has continued over the last decade. So we've seen a very big decline, we think, in unintended pregnancies over time, which is really, I think, an important trend. And people have been thinking a lot about that. Is that about information? Is that about changes in access to contraception? What's going on? Is it about different types of media coverage that have been kind of opening up more cultural conversations? Is it about increases in the job opportunities for young women? So we could think about all sorts of things. I don't really know the answer to that, and I'm not sure there is a good answer to that yet. It's something. It's one of those golden questions I'd love to see answered in some papers.
Thanks. And then one more, I see an audience question here. I just want to make sure getting to what the audience is interested in too. They're asking, how would your results change if you were collecting these results after the reversal of Roe v. Wade. And I'll just tack on and just asking, similarly, asking you to predict the future here, given the turbulence. Recognize Michigan may be in a particular position with, as I understand it, some states are banning abortion, some have already. Michigan will make part of that determination in November. Would just love to hear your thoughts on this context, especially around IUD usage and how that also has a lot of, I think, misperceptions around it as well.
Yeah, so you're absolutely right about Michigan. We've been kind of, this would be our most recent study phase. If we wake up one day and, you know, something has happened and now there's no more abortion available in the state, right? It could happen at any point. It may still happen, and it's definitely on the ballot for November. So that's, you know, there's a lot of legal limbo and people challenging things every day. So I call my lawyer friends in Michigan and they try to explain all of the nuances to me. So anyways, a lot of legal limbo in Michigan. One of the things I think that's important here is you think about, so there's two ways to you know, if you don't want to have a baby, you can use preventative contraception, or if you get pregnant and you don't want to have the pregnancy to term, you can seek an abortion. So one of the things that we're doing in an environment where that is available, we're looking at how much financial barriers matter. Now, if you think that a lot of women who can't afford contraception are avoiding childbearing because they can use abortion as another way to prevent that birth, we suspect that in the environment where that option goes away, that we'll have a lot fewer women seeking abortions. So our results at the end, where we're saying we're reducing the number of abortions by about 8% and childbirth by about 3.5%, that those actually may no longer be the cut. In fact, the reduction in childbearing may be much larger than the reduction in the number of abortions.
Thanks, Martha. I guess we will see more in the future as you provide more results from your study. It's ongoing, is that right?
Right. So we are in the field, we think, until early 2023. We're trying to extend so we can pick up more of the post Dobbs period as our study. That happened kind of right at the end, and we don't want to have sample sizes that are so small that we can't say too much. So we're trying to extend that, but you know, fundraising at the last minute is challenging. So if anyone's watching and they're interested in contributing, it would be great to get in touch.
Thank you. So for the last few minutes, I'd love to go around from the top of the presentations to the end, asking about some key takeaways that the presenters would like us to have. And so if there's a key opportunity for research, future research related to what they've been studying and what they've been thinking. And as an organization that seeks to translate research for policymaking, and given my role as policy director, that is something I'm very keen to do. What is a key takeaway you'd want to make sure policymakers or the public at large have from your research? So I will turn it to Ingrid, if that works.
Great, thank you so much. This is a great question. I think I would like to encourage everyone to really try to have a closer look at the lower level of the job ladder. When you talk to a lot of organizations, you ask them, how many women do you have at lower levels? They can't answer this question. If you ask how many of your programs are for women who are not executives or high potentials, very few are. So, you know, often we only focus at the women who already made it to a higher level. That's the same in academia, same in politics. And so even though it's really hard, try to encourage researchers, organizations, and policymakers to really try to look at this really critical transition early on in people's careers and see if, you know, we can change some of the systems to make them work for both men and women.
Thank you so much. I'm already excited that I'm asking this question based on that answer. I will pass it on to Naomi.
Thank you. And I should say, June and I had the benefit of Nancy Fulbray was going to be a discussant. We had the benefit of some of her observations and some of her work. And one of the places where she wound up, she's done lots of amazing work, but what she recently just sent us was some of her an article on care work. And what's interesting is, although our book has many recommendations, one of them is the importance of collective action, and that's something that isn't necessarily going to benefit people at the top, but it does benefit people sort of, outside of the most visible professions that we often study. So care workers, elder care workers, Betty Dukes at Walmart. We also look at dental assistants, and so collective action, the importance of union, the importance of unity, and then a whole bunch of other proposals that we also talk about, which include things like being able to have better control over reproductive health, over care organization, and then focusing not just on the number of women or the number of men, but on the masculine and feminine norms at work, and trying to do something about that through, among other things, changing the tax code. So a whole bunch of policies all over the place. Thanks.
Thank you. Sounds like we have a lot of work to do here at Equitable Growth and all the translation that needs to be done. And last but not least, I'll turn it over to Martha. Thanks.
I think the big picture I'd like everybody to take away from my talk is that I think in the aftermath of the Dobbs decision, sort of the reversal of Roe v. Wade, there's been a lot of discussion, a huge national discussion about how we can reverse these legal changes or how we can minimize their effects. Unfortunately, increasing access to contraception hasn't been a really big part of that national conversation. And one of the things I think that we should think about, and not that we should give up on all of those other strategies, but as a complement to those other types of things that are happening, we need to think about making contraception as low cost and as accessible as we can.
Thanks, Martha. And with that, we are 2 minutes over, but I think only 2 minutes over. We had a great discussion around, again, all these issues around gender inequality, employment, corporate culture, reproductive health care. There's so many more things that we could have talked about, so many more questions could have answered, but I really appreciate everyone coming and to our presenters and Discussant for their willingness to participate today. With that, I will leave y'all to take a little bit of rest before our next session, which will start in half an hour. Thanks so much.